We work hard throughout our careers to provide for our families, to own a home, and ultimately to retire to a life of simple pleasures. Ask any senior what is most important to them as they age, and most will answer staying healthy and maintaining their independence. It would be difficult to find anyone in this country who hasn't either had a family member or close friend experience a fall. And we know that sometimes the consequences of these falls can be very serious. The good news is that we have identified a number of characteristics that increase the probability that a person will fall. These include use of medications, how people learn to control their balance, and also a number of environmental factors which we know can combine to increase the chance that a person is going to fall. And we also understand now what can be done to reduce those risks. In spite of our best efforts, some people are going to experience a fall, and what we wanted to cover today is techniques that a person can use should they fall and want to get up from the floor unassisted. For the purposes of demonstration today, we have Dorothy here, who's our healthy volunteer, and she's going to demonstrate the system that we recommend. So first she's laying still, collecting her wits, then she's looking over to identify a substantial piece of furniture. You roll your head in that direction, roll your shoulder, your pelvis, and try to get over onto all fours. And when you first lift your head up, if you can find a comfortable position, and then just rest for a second, because now you've lifted your head and we want you to have a moment for your blood pressure to reacclimate. When you feel like you're not dizzy, go ahead and get up on all fours and then crawl over to the piece of furniture, if possible. And then put your arms up on the seat, and then use whichever leg seems like it would be the most substantial. Get it up next to the chair, push down, pivot around, and be seated. And after you've completed this transfer from getting up from the floor, it's important to make a mental note to yourself that you're going to bring this up with your primary care provider. Because what we want to do then is to look for what is it that's going on in your body, in combination with your environment, that caused you to have this fall, because we know that a person who has fallen is at high risk of having this happen again. If you are worried about falling for yourself or for a loved one, know that you are not alone. The danger of falling among older adults is so prevalent that preventing them has become a national health priority. To learn more, please visit learnnottofall.com and stay tuned to this website for tips and techniques about staying healthy and home safety.